Welcome to the Prescription for Admission podcast, where we talk about hospitals and hospital-based care, who you can expect to meet, and what you may experience during your time in the hospital, both as a patient and also as a healthcare provider working in a hospital. My name is Dr. Monique Nugent. I am a practicing hospitalist and also the author of Prescription for Admission, the book, where I talk about many of the same topics. Thank you for joining me and enjoy the show. Hello and welcome back to the Prescription for Admission podcast, the podcast where we talk about all things hospitals. Today is a really unique episode of Prescription for Admission where we will not be joined by a healthcare professional. In fact, we're going to be talking about the patient experience and the advocate experience of a hospital stay. So today we're joined by Lisa Braxton. Thank you so much for being with us, Lisa. And she's going to talk to us a bit about her experience advocating for others through a hospital stay. So a bit about why I've asked Lisa to join us. As my work as a hospitalist, a lot of my patients are elderly, and they require the assistance of their adult children to either outright be their healthcare proxy and medical decision maker, or to be their support for medical decision making and care also after a hospital stay. This is a really unique experience and an experience that a lot of us will have over the years. How you experience this and how you work to advocate for your loved one through a hospitalization can really take different forms. And sometimes people will find themselves not being able to physically be in the room. And that brings another layer of I don't want to say complication, but actually complication in how you communicate and how you advocate for somebody. And so Lisa has spent time caring for her parents through hospital stays, and she's going to tell us a bit about that experience and what we as healthcare providers need to know when working with adult children or any other person who's helping to advocate on the side of an elder, again, as their healthcare proxy or as their main source of support through medical decision making. Lisa, thank you so much for being with us.
Well, thank you for having me.
Can you tell us a little bit about how you and your parents came to that point in your experience where you were really their voice during a hospital stay?
My parents were both slowly going downhill in their 80s. And my mother, eventually she was diagnosed with ovarian cancer. And my father had dementia, and he also had Parkinson's disease. And Mom got very sick, quick, more so than death toward the end, toward the last couple of years of their lives. And my mother passed out during Thanksgiving dinner 2018, and we had no idea what was going on with her, why she passed out. We took her to the hospital. The doctor said, oh, well, she's going to be fine. She just didn't have enough water with her medication, so she was dehydrated. But as it turns out, there was seriously something wrong. We didn't know what it was at the time. I live in the Boston, Massachusetts area. My sister lives in Rockville, Maryland. So neither one of us lived in Bridgeport, Connecticut, where my parents lived. And that was tough because we were both in different places and coming back and forth. We could do that, but we were working full time also.
Yeah.
So as it turns out, my aunt was the person who was the point person, the primary caregiver for my mother, because my aunt lived one town over from my parents. So she would take my mother to appointments when I couldn't drive back and forth. And the good thing was there were a number of doctors who agreed to allow her to record the appointments on her phone. Some said no. And that was tough because the ones who said no, my aunt had to paraphrase to my sister and me, call us up later, paraphrase what the doctors had said. But the ones who allowed the recordings, that went very well because my aunt would email the recordings to my sister and to me. We could listen to what the doctors were saying. We could hear my mother, who sounded, as she did, frail, but she was participating in the conversations. I could get a sense of how caring or how sensitive the doctors were to her situation. And that made a huge difference. And I will say there was one doctor her primary doctor during this journey of her cancer, who said, we took a specimen and we sent it to the lab to get the results. And what do you think, Elizabeth, we did with that? And she made a funny remark. I guess you probably threw it away. No. What do you think we did? So he would ask her questions to make sure she understood the process. And I thought he was a very sensitive, good doctor. And that was good to have those recordings, to hear what they were saying. So if there was something amiss, I could always call and say, well, what about this? So having those recordings, that was
That made a
critical.
big difference. So you brought up a lot of really great points, and I'm just going to pick at them a little bit. Your mother passing out at Thanksgiving, crisis. A lot of elder care and caring for others is kind of like crisis centered, right? Like people think that someone is doing really well. Holidays, as a hospitalist, I'll tell you, holidays are when people figure out someone isn't doing really well. They end up going to visit Nana. They haven't seen Nana in 9 months, and the house isn't disheveled, and Nana doesn't know where their checkbook is, and suddenly people are thinking, oh, there's something going on. But that crisis point, you were with her, you were physically with her. And so you were able to physically be there and navigate that. But then you said we were working full time, right? Hospitalizations don't stop everybody's timeline. They stop the patient's timeline, but you're still moving around doing your life. And I think that's really smart that you figured out you had to have a face in the room. You had to have a man on the ground. And that was your aunt. Having those recordings sounds like it was gold. Do you feel like that's something that we as healthcare providers should be a little bit more open to? Because not everybody is open to that. And a lot of hospital policies will outright say that, like, unless given permission, you're not allowed to record, you're not allowed to videotape people. How does technology kind of bridge that gap for you?
That made such a big difference. And it was interesting because at the same hospital, most of the doctors said, yes, go ahead and record. It's fine. A few said no. So I don't know what, I'm sure there was one consistent policy, but some were okay with it. But having those recordings, being able to have my aunt record what was said to my mother and to my aunt, that was a lifesaver. That really was. And I'm hoping that doctors who feel uncomfortable with it understand that we just need to get the information, especially for us who are out of town, and also to remind those who are in the room advocating for the patient to remind them of what happened during the appointment. Because sometimes my mother had so many doctor's appointments. She passed out on another occasion. She was hospitalized again. And after a while, it just becomes mush in your head because you've got so many appointments, so many things are said. It's so important to have those recordings. So I say technology has really made a difference.
Did you and your sister also take advantage of portals, the apps that the hospital will have or your doctor's office will have? I know this was a bit ago, so they're a lot more popular now. Was that something that you guys had at your disposal? And how did you feel about it if you did or didn't?
We didn't know about any apps. Just relied on the phone and also on the iPad. iPad made a big difference.
Yeah.
When my father was hospitalized after mom passed away, we both, my sister and I, after the funeral, after a few days, we went back to our respective states because dad would not leave the house. We tried to get him to come with one of us. He wouldn't do it. And we couldn't get him into assisted living at that point. He would not do it, but he caught COVID. And when he caught COVID, he was hospitalized. We had a physical therapist come in to work with him, and the therapist noticed there was something off with the way my father was talking. And so called my sister, and she said, call 911. In the hospital, dad was diagnosed with COVID, and we were just so scared to death because he was about 87 at the time. Yeah. But he was doing okay. An advocate, social worker in the hospital advocate said, he's doing fine, and I've got this iPad here, and you can see him and talk to him. So she put the iPad on, and we were able to wave, hi, Dad, and see him. And they had him pumped up on drugs. He was smiling and laughing and talking to us, and he seemed okay. And it helped us to feel, okay, Dad's okay right now. Yeah. He's getting the best treatment. And I think at least another time, or maybe 2 or 3 times, that social worker did go on her iPad and have us see Dad and have him see us and talk. So yes, that iPad also made a huge difference for us.
Yeah, I remember in the pandemic when people were hospitalized, that was a tool that was being used. And I think it was really important for us to recognize that seeing your loved one face to face on a good day is just as important as seeing them face to face on a bad day. Right? Yeah. For everybody, for the patient, for their loved ones. So that really did, I think that was a great use of technology that bridged that gap because people weren't allowed. Even if you were in the same state, that there was a chance that you may not have been allowed to visit him during that time.
Right. That's true, because when we got him transferred to a nursing home, we could see him outside. He was on the first floor, so we could go to the window outdoors and look at him through the window, and he could wave at us through the window, but we could not go in and see him.
Yeah, those were really tough on everybody. Really, really tough times on everybody. So while you and your sister are working together from a distance with your aunt, right? Your man on the ground, how did that change during a hospital stay? Because now there's more people than just the doctor in the office, right? You've got nurses that I'm sure you want updates from, you've got physical therapists, and you have to work with the case managers and the social workers about discharge planning, right? How did that change, and how much were you on the phone?
That didn't change a whole lot. Mostly my aunt, just at her discretion, she would record the doctors. She didn't record the other people who came in. But I will say that another important piece of this is the old-fashioned technology of actually getting on the phone and calling the doctors. Because my sister, at one point, my mother was in grave condition, and she called the hospital and talked with I'm not sure if it was a doctor or the nurses, but the mom was stable. And then my sister called in the middle of the night to check again. Mom was not stable, and they thought she wasn't going to make it through the night. So repeatedly just checking on your loved one 2, 3, 4 times in the middle of the night. Don't feel bad about that. Don't advocate. Don't feel bad about calling again and maybe feeling like you're a pest. Check on your loved one. Call the nurse's station. And that's what we did. That's what my sister did several times. And because my mother's condition was going downhill. And so we knew to get there and drive there at that point to see about her. And as it turns out, she was able to rally because a doctor that we talked to, who in my mother's hospital room had the x-rays reviewed again and said, I can get that tumor out. I can get that out. And we saw her face to face. She was very confident, and that eased our concern. And she operated, and Mom did. Mom had to have a colostomy bag, but she lived for another year, a little bit over another year. Mm-hmm. So having that confident doctor talk to us in that way, that was really important. That was something I will never forget.
Yeah. And you're right, as much as I just tried to tout iPads and apps and recordings, there's the old-fashioned pen and paper that I advocate for. Write things down, because as soon as the doctor or the nurse, whoever walks in the room, that what your question like flies out of your head, because you have an immediate question here, like you turn off that IV pump, and then everything else you wanted to say goes whoop right out of your head. And then the telephone, making a call, getting to speak one-on-one and getting your questions answered, getting your concerns heard. That is also like really, really key, because that's really what's going to happen is you're going to give them your whole take on the situation and your fears. I had a pediatrician that I spoke to for the podcast not too long ago, and she said, name it. Name your worst fear. Like when you're talking to your physician, what is it that I'm afraid of? Because now you have my ear. And so tell me what this thing that you're thinking about, so that I know what we need to be working to rule out, what we need to be working to address. And so I think that's really great what you said, the phone call. Kind of, it sounds like you got what you were looking for, which was a confident person to review things and make a plan.
Yes, exactly.
Yeah. So plan making is huge. And leaving the hospital, a lot of our elders are not always able to go straight home. And sometimes people have to go to a rehab or a nursing home or things. How did you navigate that? Because finding a place that like your insurance takes, that you're comfortable with, that looks good, right? Because what it looks like in the brochures can often be very different from what you see in person. How did you all navigate that from a distance? Because there's a couple steps, right? From working with the case manager to find that, like, yeah, we need to do that and we need to start looking, and then actually finding the place.
Well, I would say in my father's case, we had after the nursing home, after the insurance ran out for that, we were looking for a private care and assisted living during COVID. So several of the places that we were looking at, they got on their Zoom account, and they talked to us about the place, and then they would walk around with their laptop, and they gave us a tour, a Zoom tour of the facilities. And that made a difference. And because, my parents were from Bridgeport, in that area, we knew people who were living at that place, who were at that assisted living place. So we got personal referrals from people about how the place was. And that was very helpful. But I would say that the tours with the laptop, flipped around, and they're walking around and they're showing us everything, that was very good. I mean, you have to adapt during those situations, and that helped. Mom went to rehab also for a while. And I have several relatives who either have worked at those rehab places or they know people who were living there at the time. And my aunt knew a lot of people who were connected to those potential rehab facilities. Mm-hmm. And there was one in particular, she said, no, we're not going there because they did not have a good reputation. So she was very helpful. My aunt was very helpful in that respect.
Yeah. So everything that you said are things that I advocate for patients. And I love hearing it from someone who's had the experience, personal reviews and personal experiences. So if people that you have any kind of experience with these institutions, ask them. I recently had a patient tell me that one of the ones in my neighborhood was the best kitchen. He's like, they can cook. I've been to X ones, but that place, they can cook, right? So he has like a different take on it than me, who just knows where I refer patients with certain types of needs. And then I love how you said adapt, man on the ground, right? The tours, see it with your own eyes, or send somebody to see it with their own eyes and lean into what you know about it in the community. Because
what was good also with my father, once we put him into the nursing home, since there were people we knew who were there, they were there. So he could, in his wheelchair, roll himself down to his buddy's room and chat with him, or roll down to so-and-so's room and that he knew and borrow their telephone to bother people. But he was able to, there were people there he knew, and that made a difference. So it wasn't so boring for him being there during the period of time that he was there before we got him into the private care.
That is really awesome. That's something that I have not heard before, but that's great because that's community, right? So he was in his space, in his home where he's comfortable, and people want to be there. And so going to a place after the hospital can be isolating, but you found him community. And that is beautiful because that's going to also boost his spirits, help him participate, feel like he's not in it alone, right? Mm-hmm. That's really great. I like that one. Thank you. Thank you for that. And so you were really kind of doing a lot, right? And hospitalizations, I say they're busy times for everybody involved, right? The patient is in the hospital. They have to participate in their care and in their therapies and help, advocate for themselves. But you are their support on the outside. You're putting together all the logistics because it's not easy to get people into these different facilities and different forms of care. You are speaking with your sister who is helping you make decisions, right? And also keeping an eye on your parents while they're hospitalized. You're advocating with your aunt during doctor's visits, both in the hospital and in the clinic. And you're working full time. And you're in a different state. Right? Caretaking in this country takes on a lot of different models, right? And some people think caretaking is simply you live with someone and you are doing the moment to moment things. But what you were doing is no less intense, right? How did you find ways to go the marathon? Like, what was your building of resilience? Because that's still a lot. Emotionally, logistically, it's a lot of work.
It was a lot of work. I think that the fact that I had other things that I was doing at the same time. And when I would come down to see my mother, for instance, my husband and I just gotten a puppy. And so my mother actually she did home hospice. She enjoyed the puppy. She enjoyed seeing me with the puppy and holding the puppy. And I would have to walk the dog in the front yard or the backyard. And I didn't realize that, but me just leaving the dark bedroom where mommy was with the TV soap operas down low while she's taking a nap, walking outside and walking the dog for that little bit, getting some fresh air and then going back in. Things like that made a difference. And we discovered, my sister and I were both there at the same time. Sometimes we were there at the same time. Sometimes we would trade off. But we found that we discovered this dog park up by one of the universities just outside of Bridgeport. While my aunt would come by and sit with my mother, my sister and I would go to the dog park so the puppy could get some exercise. And later on reflecting, I realized, yes, the puppy got some exercise, but we also got a break. And there were some Sacred Heart University students in the area doing disc golf, and they took photos of us. They played with the dog. We chased the dog around, and then we go back, and it's like, yes, thank you. We had a break, and we're back, and we're refreshed, and we're ready to spend the evening, because my aunt would come when we were all there. She would be there during the day, and in the evening she would go back to her home and do her own things. So having those breaks, that really made a difference. Getting fresh air, running around, a little bit of exercise, those things. Sometimes people forget that when you're caregiving, yes, it can be 24/7, but to be able to do 24/7, you have to take care of yourself.
Yeah.
Get a break, get someone to come in for a little bit, even walk. I walked around the mall a couple of times just to rejuvenate. Those things really helped.
Yeah, that is key. That is really key, is taking care of yourself, allowing your community to rise for you so that they can take some of the burden, but also people want to participate, right? Your aunt wanted to be there for her sister, and that's an honor that I'm sure she also really felt moved to participate and fulfill. Your sister, clearly you all are a team. And so having that community, taking those breaks, caring for yourself. And I like saying those things, but I also kind of don't like saying those things because I never want to pander to people to say, because I know we live in the world of like self-care, right? We live in a world of, of like everything is fluffy and like do your mask with your under eye bags and you will feel better. But that's not self-care, right? Self-care is being able to find the way to go the distance. And that often requires community, breaks, support for an animal, and the fact that it brought joy to your mother as well, right? And so those are really the things that they're unsexy, can't subscribe to them, they're not going to come in a box from Amazon, but they're the things that are going to make the difference for you. And I think that's really very key. So thank you for sharing those insights with us. So what 2 pieces of advice would you give to hospital-based healthcare professionals, physicians, physician assistants, nurses, physical therapists, whoever it is who is working with a patient advocate, a caretaker who's not physically there? Because it's a different experience. What would you say your 2 biggest pieces of advice for us would be?
I would say just make yourself available and accessible, because, for instance, there was one doctor, they were going to do another surgery on my mother to try to clean out all of the cancer. And I was very nervous about this. My mother was 83 at the time, and I did not think it was a good idea for her to have another surgery. But her doctor called me around 7, 8 o'clock at night when she was available, and we talked at length about it, and she helped to ease my concerns. And making yourself available at night, I know that wasn't during her typical hours, that was very helpful. Another accessibility, another doctor said, I have a window of time at the hospital. I have a window of time of this time. So if you want, when you're here, I was driving to Bridgeport. If you're here at that time and you want to talk, here's when I'm available. So making yourself available that way. And I would say, let the patients record the doctor's visits. Be open to that, because then you hear everything. And it really does make a difference, because then the caregiver can better strategize how to proceed next if they know what's going on. Because if they're not there, they're not there. But at least they have all the information. They hear all the information. And that's so important.
So I love it. Make yourself available and be open and honest to have full conversations at the times that you're available, and record or leverage technology in a way that allows the caretaker to know what's happening, right? I love that. I think that's really great. I don't have a lot of people who ask to record our full conversations. What I have done in a few times is say, like, can I send your daughter like a voice note? Things like that. I think that's really, those are key, right? This is 2025. Let's see how we can leverage the technologies that we have of communication to kind of ease this burden of advocating from a distance. So Lisa has written a really great book talking about her experience as a caretaker, caring for her parents. Tell us a bit about your book, Lisa.
My book is titled Dancing Between the Raindrops, A Daughter's Reflections on Love and Loss. I began writing it around the time that my parents health was going downhill. And we knew that they didn't have much longer. And when you get to that point, I think a lot of us start reflecting on our lives. And I would reminisce about Dad teaching me to ride a bike, the time his brother brought up a frozen squirrel to reminisce about the old times when they were kids in the country and they would catch squirrels and fry them up. And, Mom and I my mother would bake a chicken, then we would take the wishbone on our pinkies and pull it apart, and whoever got the biggest piece got their wish.
Yeah.
And also about the journey, the caregiver journey, which was just, as I've described it to you, it could be stressful. So I wrote a memoir and essays. That's what this is, memoir and essays about growing up with Mom and Dad. They were young parents when they had me, and also going through the years and what it was like to be there with them when they took their last breaths and to care for them through that process. My hope is that when people read the book, and if they're grieving, they will see that they're not alone. Mm-hmm. My friends, other people who read it, they've said they've laughed at parts, they've cried, they've said, the same thing happened to me. So I'm hoping that my book will offer some comfort to people. And also, it's family stories. I wouldn't say it's sad, it's family stories, and there are themes of grieving within that.
It's beautiful. Caring for our elders, our parents, reminiscing on the journeys of growing up with your parents. I'm a little bit of an older parent, but I still tell my first daughter, like, you and I are growing up together. Like, I have never been a mom before. You've never been 7 before. So, we're doing this together. And I love that. Our experiences as families are so rich, and to be able to put that down in essays and pen and paper for people to share and to talk about grieving is beautiful. Where can people find your book?
Well, it's available on Amazon, also from my publisher, Sea Crow Press, and also from my website, lisabraxton.com.
Lisa, thank you so much for joining us and for telling us about this really important experience about advocating for your loved ones from a distance, and also for sharing some of your stories with us. This has been really wonderful. We as healthcare providers always should be reminded that every patient, as my mother says, is somebody's sweetheart. And every patient is somebody's soft place to land. So treat them with love, care, and respect. And thank you so much for, again, showing that to be true. And everybody, thank you. I'm so sorry. Thank you for listening to the Prescription for Admission podcast, where we talk about all things hospitals. This has been Dr. Nugent, your host, with Lisa Braxton, talking about the experience of advocating for your loved ones from a distance. Thank you so much, everybody, and have a good one.